Rusan Pharma Limited is a fully integrated global pharmaceutical company with specialization in opioids, alcohol and tobacco de-addiction since the last 2 decades. Rusan has been treating patients for the indication of alcohol addiction with naltrexone tablets, and now for the first time has indigenously developed the 12-week naltrexone implant for marketing and distribution in India and globally. Our implant has undergone a series of trials and is being used in Asia, Africa, Europe, etc. We will now take you through a brief procedure on application of the implant. The following presentation illustrates the procedure for insertion of Adtrex naltrexone implant for the indication of opioid and alcohol dependence. Step 1. Once the patient has been educated about the therapy, the patient has to sign a consent form. The patient will be put on a 7 to 10 day detox and must be free from opioid and/or alcohol intake for this duration. Post the detox, a urine sample will be tested and cleared for further implantation procedure. Step 2. The patient will lie down on the surgical table. The recommended site for the implant is in the lower abdominal area. The doctor will decide which side of the abdominal should the implant be inserted. In case the patient has been through the procedure before, the doctor will decide the side accordingly. The surgical sheet is placed over the abdominal area and the surgeon prepares for the sterile procedure. Surgeon applies a local anesthetic, moving the needle around the incision site. Anesthetic is administered so that the patient will not feel any pain during the procedure. It is probable that the patient may still feel some pressure on the lower abdominal area. Step 3. After a few moments, the surgeon touches the area for numbness and a vertical incision of 1.5 to 2 centimeters long is then made using a scalpel. A pocket measuring 5 centimeters is created in the subcutaneous area using surgical scissors. Next, the implant is inserted via a container into the pocket created. The sterile implant is pushed from within the syringe, which is then withdrawn, leaving the implant in place. The presence of the implant should be verified by filling it immediately following the insertion. The incision is then closed using 3 to 4 stitches, also in some cases with cut-seal surgical glue. As a final step, a sterile dressing is placed over the area to reduce the risk of reactive bleeding. The patient is asked to apply mild pressure for 5 minutes over the incision. The patient remains in the clinic for a minimum 30 minutes following the procedure for observation. The wounds should be kept dry until sutures dissolve or are removed. No heavy lifting or strain for 7 days is recommended post the procedure. Within a few hours of receiving the implant, the naltrexone is released into the bloodstream and begins to make its way to the brain. Inside the brain, there is a complicated network of neurons, receptors, and neurotransmitters that mediate the cravings for alcohol and drugs. Once the naltrexone reaches the brain, it occupies and blocks these receptors. These serve to diminish the stimulatory and reinforcing facts of alcohol or opiate drugs and decrease the compulsive urge to use or drink. The naltrexone is preventing the release of dopamine and significantly reduces or eliminates the compulsive cravings to 1. Drink, 2. Use drugs, 3. Or whatever other obsessive addiction has hijacked the control center of the brain. The implant lasts for 12 weeks in most cases, depending on individual factors. Many patients report that their cravings are significantly reduced the same day.